Medicare is anything but free when you retire. It'd have been cheaper for me to stay as a full employee. It's just fascinating that, anyway.
All right. So
I learn something new every day.
Yeah.
But it's great seeing all of you.
My son actually asked me a question the other day about why would people be opposed to free health care? I was like, whoa, health care is not free, okay?
Well, yeah.
While we were waiting, does everybody see the same screen? Is it like all the boxes?
yes.
Okay.
Yeah, I see you on the main screen, and I see some of the other folks on the side here, and I assume that. Yes.
All right. Does everybody know the Brady Bunch song?
Yeah,
you
some of us.
that? Go ahead, Rick.
I said some of us grew up with those kind of shows, so yeah.
I love the Brady Bunch.
Yeah, it would really work right now.
You're right. You are right. So we've maxed out on, I think we have about 20 per screen for myself that I can see. And then we're up to 57, moving right along. Very good. Everybody's coming in right on time. We got about a minute.
All right.
Good morning.
Good morning. So I did want us to open up and see everybody's lovely faces. Thank you so much for showing your video.
Morning, everybody.
You're welcome.
Love the red dress.
I know she was supposed to wear the shirt, but no, if you recall correctly.
Darling.
T-shirt for this momentous occasion.
Julie, good to see you. Julie, you're living the Brady Bunch, right?
No, you guys started talking about the Brady Bunch song. I'm like, that's my life.
I remember.
All your Facebook pictures, that makes me think about the Brady Bunch.
Yep, I've got the Brady Bunch. I'm living that.
Yeah, that's right.
Oh, yeah.
One morning I was at Julie's house. We were getting ready to go. She really was like handing all of the lunches to the kids. And I got in the line. I got me a lunch too.
I was like, Benita, just come on in. One more don't make a difference.
The bags with little names written on them. All right, welcome. All right, so we're going to go ahead and get started because we have quite a packed event here. And I'm going to turn it over to our illustrious Master of Ceremony, Mr. James McQuilla.
All right. Well, good morning, ladies and gentlemen. Okay, since everyone's muted, I guess they can't say good morning.
Good
morning.
All right, well, I want to welcome everybody to the South Carolina Community Health Workers Virtual Mini Conference. Yay, let's get it started. So, as we can see, this is brought to you by our by Zoom, and we're gonna get to all the great stuff. But first, I just want to let everybody know my name is James McQuilla, and typically I'm the president of the Orangeburg County Chamber of Commerce. But today I will be the Master of Ceremonies. So what that means is I'm going to guide us as we kind of go on this journey together. The first thing we like to do is thank our sponsors. So thank you to all of our sponsors. You can kind of see everyone listed there, our platinum sponsors, gold, silver, bronze. These are all our Olympic sponsors since we're not going to have the Olympics this year. All right, so we're going to get past the welcome, but I'm going to go through a couple of housekeeping rules. As you can see on your screen, you want to keep your audio on mute unless you're speaking. Please verbally ask to speak. Do not raise your hands because we may not be able to see all of you. There's hundreds on here. All right. You can select individuals to privately chat. I'm sure most of us have been part of a Zoom meeting or conference at some point since COVID. Make sure you accept the breakout room invitation. Once that takes place, you'll see it on your screen. We're going to have drawings for prizes. One's coming up very soon. You all will be shocked at the prizes that we have. Okay, I know I'm going to be. We're going to have the winners have 10 seconds, okay, to respond in the chat. It's very quick. You can do that. Please show your lovely faces so we can see you all. And of course, for any technical issues that you have, give our board chair, Mr. Darren Thomas, a call. The numbers on the screen. All right. So again, thank you all for joining us in this first annual virtual mini conference. We go into, as you can see, those are my brief opening remarks. And so I'm going to turn it over to the SCC Health Worker Association Board Chair, Mr. Darren Thomas, and also the Executive Director, Ms. Benita Clemens. So Darren, take it away.
Yes, good morning all. I hope y'all are doing well out there across South Carolina and wherever else you may have signed in virtually on this today's meeting. My name, as he said, my name is Darren Thomas. I'm the chair of the board of the South Carolina Community Health Worker Association. Today during this conversation or during these several meetings, you may hear the term SCCHWA. So that's not an audio issue or anything like that or any Southern drawl of a particular word. It's our pronunciation of the acronym for South Carolina Community Health Worker Association. So with that, I want to welcome you all to the SCCHWA Mini Conference 2020. Now, I normally ask the board members to stand and be recognized. However, since we're not going to be able to do that, I'm just going to go by and identify them by name. So we also have the Vice Chair, Durell Fox, Secretary Scott Thorpe, Treasury Kelly Duff, board members Mark Calhoun, board members Anna Cascio and Tracy Golden, and board member Terry Jowers. And we also have professional advisor Julie Smithwick. I'd also like to recognize the executive director of SCCHWA, Benita Clemens, and Donna Mack, who supports the association with her expertise in project management and technology. She's the one that's really worked on these this endeavor here for us. So first of all, I'd also like to thank our sponsors. We've gone through those. You saw plastered there on the screen, but I want to give a shout out to them as well. For them, we wouldn't be able to have made this conference happen. So our platinum sponsors, Center for Community Health Alignment. Our gold sponsors, Blue Cross Blue Shield of South Carolina, Care South Carolina, Molina Healthcare, and South Carolina Thrive. And then also our silver sponsor, South Carolina Department of Health and Environmental Control, and bronze sponsors, Access Health South Carolina, Center for Vein Restoration, Nurse Family Partnership, Spartanburg Regional Healthcare System, South Carolina Healthcare Education Consortium, also known as AHEC, and our South Carolina Respite Coalition. We're so grateful for the support of our corporate sponsors who are committed to helping people strengthening families and building stronger, healthier, and safer communities. Together, we are helping make a difference in the lives of so many South Carolinians. Now, I also want to thank you all for your patience as the association navigated this current environment. The team has made several difficult decisions, from canceling the conference to rescheduling to unfortunately canceling again. But Benita, who you'll soon meet here, was not going to let community health workers of South Carolina go without coming together to learn, network, and present ideas. I would say sit back and enjoy the South Carolina Community Health Worker Association Mini Conference 2020. But if you have been in any quarterly meetings, you know that it is not possible with the next person who's coming up to speak. She will not allow you, rather, to sit back and remain idle. She and her team have created an energetic and interactive program for you all today. So enjoy, learn, make new friends, and only sit back when you can. Now, please welcome Benita Clemens.
Good morning and thank you. Now my office phone is ringing. So I'm not gonna answer that. It's gonna go straight to the voicemail. Probably someone. Stop ringing phone. Okay, so good morning everybody and welcome, welcome, welcome to our first annual conference for the South Carolina Community Health Worker Association. I need for everybody to give ourselves a clap for the CHWs of South Carolina. This conference is for you. You will hear me say community health workers or CHWs, it's the same thing. So again, community health workers, we want you to know that we appreciate all of the hard work. And as Darren just said, we were not, it wasn't just me, it was a team effort. We were not going to not have a conference this year. And so thank you, Donna, for helping to make this Zoom, I'm gonna say perfect, because it's gonna go really smoothly today, really smooth today. So again, community health workers, this conference is for you. You are the frontline workers. You're lifting the heavy loads. You're ensuring that our clients are getting what they need during these trying times. And again, on behalf of the leadership team, that's the board and all of our supporters, we want to say thank you and give you a tremendous appreciation and gratitude for you and all that you've done. We all know that 2020 has been a very challenging year. But in response to this challenge, we've been trained. And so what did we do? We just pivoted and we chose to do things differently. As our board chair has said, we've canceled, rescheduled, rescheduled the rescheduling, but today we are finally here to celebrate. And, you know, we did this because we felt like it was the responsible and conscious thing to do, you know, to safeguard everybody's well-being. We did not want to take a risk and come together. I understand that there are some groups that are kind of coming in together, but again, we wanted to let you know that we care about you and that your safety and well-being is number one. I want to personally thank the board at this time for all of your support, your guidance. Anytime I've ever called you for anything, you've always been there, always willing to help. Darren and I spoke last night, kind of late, you know, just making sure that everything, all of the final touches was done. And it's so refreshing as an executive director to be able to feel that I can call all of my board members. Hang out with one of them sometimes, Miss Julie, where we used to before COVID. And also want to thank the Center for Community Health Alignment. We meet every week. They also support and always willing to help us. I want to thank the annual conference committee for all of your time, energy, and efforts. And thank you, Donna, for all of your assistance, long hours and hard work. And Mr. MC, James McQuilla, thank you for helping us to get this started right. Because when we start right, we end right. So getting back to our CHWs. CHWs personally, thank you for rising to this occasion. We know that during these times it's been tough, it's been hard. You have so many accomplishments, and I'm just gonna name a few. You've been advocates for individual and community needs. You've built up individual and communities' capacity for wellness. You've ensured that people get the services that they need. And you've literally changed and saved people's lives. I have heard several stories that CHWs like, you are going to take your medicine. You are going to this hospital. You are going to the doctor. That's love. And again, I've heard the stories, and thank you again for just literally saving people's lives. And we also have data. We have data that shows that community health workers are among some of the most essential people in today's workforce. And we all know and believe that. Now, although this conference is virtual, we've packed it with a lot of value. We want everybody to have an excellent time. So at this moment, everybody just take a deep breath in and just say thank you that we're here. So on the count of 3, we're gonna take a deep breath in and let it out. All together as a community. 1, 2, 3. Release. Thank you. So I want you, everyone on this conference, to take away at least one life-changing, career-changing thing today. And at the end, I want you to tell us what that one takeaway is. And for those who are wondering if we're going to have an in-person conference, yes, we will as soon as it's safe. We're not going to put a date on it because we know that things change often, but as soon as we know and feel that it's safe, we're going to have one. So let's all continue to protect ourselves, use best practices, and safeguard our communities. Thank everybody for showing up for this virtual conference. You look beautiful. You look pretty. This is a wonderful day. It's beautiful outside. Let's celebrate.
And Terry, you are the most excited person I can see on the screen. I mean, I love the energy. And so we're going to need that energy because right now we're going to go into a door prize drawing. Isn't that correct, Donna?
Can you hear me?
Yep, I can.
Awesome.
Okay, but before we do that, let me just say this. I want everyone to have as Benita was saying, you want to have a good time. We want to be patient because things could happen. We want to be professional with everyone. And then we really, really, really want to engage in the sessions and have as much fun at each one of the events as possible. So the first fun event will be a door prize drawing. Now, I know some of the, everybody ready? Okay. Some of the door prizes may have changed. The original list I have, I think the first thing we have up here was a 1965 Mustang. It's valued at $48,000. Is that still correct? Donna?
Well, I think Benita would have to see if she wants to get that up. I think she's reneging on that one.
So what did we switch to?
So it's a gift card.
Oh, it's a gift card. Okay. Okay.
Yes.
So we're not going to do the Mustang, but we're going to do a gift card. Let's do that drawing first, and then we're going to do our icebreaker.
Well, we have a video first. So on your screen. Oh, do you all see the screen?
Yes.
All right. And then we'll have.
The South Carolina Community Health Worker Association is made up of community health workers and supporters who are building a healthier South Carolina through the promotion of education, networking, and advocacy for the community health worker profession. The association provides a forum for networking, sharing of strategies and resources, and provides a foundation for education of CHWs and the organizations and systems that support them. For more information, visit our website at SCCHWA.org.
Awesome. And as Darren says, that was swell. Okay, one person got that. All right. Now we're going to do the door prize. All right, so we have a gift card. Okay. And Benita or Donna, who's going to?
I sent you the name. Here, Rhonda Gervin. 10, 9, 8, 7. She's here. All right. Congratulations. Awesome. So you are the winner of a gift card. And Benita was supposed to give me the amount. That's why I was pausing. So, but we will have you a virtual gift card to Amazon, if I'm correct. Congratulations.
That sounds awesome. Yeah, congratulations. And to Ms. Rhonda. So now we're still on schedule. We want to have an icebreaker. So getting to know all of the community health workers. There's going to be a group of 3 breakout. So let's go ahead and get that done. Terry, you actually set everyone up for that. All right.
All right, so we will have.
Is also one of the same people that we consider as in the medical field as heroes, because it's tough to be able to put yourself at risk and on the line as many of you do on a daily basis to make sure everyone else is healthy. So thank you.
All right, here we go. Accept your invitation.
And it was great learning about the communities they worked in, the individuals they worked with. And one of them made a comment that this is the first time she's had a job where it didn't feel like a job.
Wow.
That's awesome. That's awesome. We're going to keep it moving. We're going to have greetings from our platinum sponsor, and that's Ms. Julie Smithwick from the Center for Community Health Alignment. So Julie.
Good morning. Can y'all hear me?
Yes, definitely.
All right. Well, yeah, that was wonderful. It was great to connect a little bit more deeply with a couple people in that breakout session. So I look forward to hopefully having more of that. But welcome, everybody. Just wanted to say welcome to all the community health workers that are out there and all of our allies, because as community health workers, we have to stand together and lean on each other. And we also really rely on a lot of our allies to help move this forward and be representatives and spokespersons in their organizations about the value of community health workers. So welcome to all you guys, and thank you for being here. A special welcome to my colleagues Durell Fox and Lisa Renee Holderby Fox, who sit on the board of the National Association of Community Health Workers with me. I'm super excited. They live in Georgia, and very, very excited to have them with us this morning as well. And it's funny that I got to speak as like the sponsor, because I don't really feel like the Center for Community Health Alignment is a sponsor of SCCHWA. What we really are is partners, and we work together every day to help advance this workforce. And as Benita said, we meet every single week to align our efforts to make sure that we're coordinating and partnering in this really, really important work. So, so really, when we say sponsors, it's only because anytime that we as the Center for Community Health Alignment get an opportunity, we find a way to include SCCHWA. That's how I pronounce it, and vice versa. They include us, and so again, it's really, really valuable that we have this tight partnership and we're working together to advance the workforce. So super, super thankful for Benita and her leadership, and for all of those who help advance SCCHWA. So the Center for Community Health Alignment, our mission is to co-create solutions with communities to advance health equity. And when we say with, this is not about or for or to communities, it's with communities. And at the center of all of our work are community health workers. So just a few things that I've been really excited about that have happened over the last year or so are, number one, that we're together with SCCHWA. We're growing and strengthening this workforce. You guys may have noticed that, especially during this stuff with COVID, that all of a sudden, instead of community health workers, people being like, what? Oh, community what? Who is that? They're coming and looking for us now, which is really exciting. Now, all of a sudden, we're really on the map, and people are starting to recognize our value. We have a larger voice together. And I think the other thing that I'm really, really proud about over the last year is that we really have advanced this model utilizing one of our core values, which is self-determination. So, it's one of the things they say, we say in the community health worker world is nothing about us without us. And we're really holding true to that. And community health workers are leading this movement in our state. So that's super exciting. So just a couple thank yous I wanted to mention. These are the major sponsors of the Center for Community Health Alignment, which allows us to partner more fully with SCCHWA, the Duke Endowment, Blue Cross Blue Shield Foundation of South Carolina, and the Fullerton Foundation. So shout out to them. And I wanted to give you a couple updates about CHWA, which is the Center for Community Health Alignment. All of you guys know that we now offer the full CHW Core Competency training, and we are going partially virtual with that training. We don't want to go fully virtual, so we're splitting it into two parts, an initial virtual, and then when we're able to gather, an in-person follow-up with that training. So reach out to us through our website if you're interested in core competency training towards certification. We also offer technical assistance to all shapes and sizes of organizations about how to implement and develop the community health worker model utilizing best practices. couple other things that are coming soon. We'll be offering specialty tracks for community health workers that want to build even more skills and knowledge around particular specialty areas such as rural health, the health of the LGBTQ population, teen reproductive health, and multiple others. And we'll also be kicking off within the next month or so community health worker supervisor training, which will be fully online. And it's for those folks who are supervising CHWs and want to be able to do that in the best way possible. So reach out to us if you're interested in any of these. And then the next slide, Donna, please. The last thing is, please, we have not had social media for a long time because frankly, we just didn't have the time or the skill set to do it. But we now have social media, and we're really encouraging everybody to link up with us on Facebook, on Twitter, on Instagram, on LinkedIn. I think you'll have these slides so you can, see those links, but please connect to us so that you can be aware of everything that we've got going on, and as we start rolling out new things to offer community health workers and allies. So with that, I'll close. So thank you so much to everybody who organized this conference today.
All right. Well, thank you, Julie. That was a lot of information, a lot of great information, a lot of excitement. We definitely want to thank the Center for Community Health Alignment and their partnership, not just their sponsorship. At this point, I want to get Benita on. I'd like for you to say a little bit about Mr. Fox, if you would, Benita. Could you introduce him?
Yes, I'm back. This is Benita. Our speaker for this morning, Mr. Durell Fox. Now his bio is in, everyone has been emailed all of the presenters' bio, so I'm not going to read his bio. I'm just going to say a few words about him. I saw him earlier, so I know he's on here. There you go, Durell. Move your head over a little bit so they can see your backdrop, Durell. Everybody know who that is, right? Mr. John Lewis. So what I'm gonna say about Durell is he knows how to get in some good trouble. Don't you, Durell? The brother has been front line for years. I first saw him at the national conference, which was last year. I started working, I think in March, and in April, I was at the national conference in Las Vegas, and he and his lovely wife, Lisa Renee, they were at the conference, tag teaming, doing the thing, making things happen. And so when we said we're gonna definitely have a conference, I said, I know who I want to come to speak. I know someone who has the experience, who does the work, who's in the trenches. And so this morning we have that person. Sometimes we don't realize we have such greatness and jewels in our hands. And he is right there in Atlanta, Georgia, close to us. So everybody, we have, again, a jewel right here in our hands, just next door to us in Georgia. Let's make sure we pay attention, write some things down, because he's gonna bring it to us. All right, Mr. Durell, get us into some good trouble.
Oh, that's what I didn't know I signed up for that. Sorry, y'all. I'm not gonna be doing it. Yo, everybody, how you doing? First of all, I'm honored to be here, and my wife is actually on this conference as well, so I'll probably have to do a timeout because of that great introduction. Sometimes she thinks I'm a jewel. Other times she might think I'm the early stages of a diamond, which is coal, or yeah, compressed coal. Would you like me to share my slides?
Well, I think you're gonna go ahead and do that. Benita, or do we want to get to that at another point? Okay, go ahead and share the slide. Yep.
Okay. I cannot. So the host would have to enable me to do that. Oh, there we go. There we go. It just flipped over. There we go, guys. Un momento, por favor. This is a technical difficulty here that we will overcome. Okay. Can folks see that slide?
Yes.
Yes.
All right. So welcome. Community connections, the foundation of the CHW scope of practice and the root of the CHW movement. That was the original title for my talk way back in the spring when we were planning an all-day conference. So I'm not going to address all of the issues that I would have addressed, but I wanted to keep that title just as a framework, as a place that we want to go and be and live at, just understanding the foundational pieces of the community, the connection to the community, as well as the paramount importance of our scope of practice. Today, I'm going to take us on a brief journey in limited time, but I'm going to talk a little bit about the background of my life and family, which has really provided me with motivation, and it really is intertwined with my CHW work, and you'll hear a little bit some of that. I'll also touch on the fact that we're all connected. I've had some connections with South Carolina in the past. I've done work in over 30 states in the country, and as well as in South Africa. And so no matter where I've gone, particularly related to CHWs, promotores, CHRs, we are all connected, and that energy permeates through our bodies, through our spirits, through our souls. I'm going to just talk quickly about and just show a couple of images around the CHW scope of practice. And some moments in history. We've had several milestones in the last 3 decades with community health workers. So I'll talk a little bit about some of those milestones. There are many, many more that I won't talk about, but hopefully the association and all the allies and partners will help us all explore some of those. I also want to honor the local movement in South Carolina. So I forgot to ask Julie for permission, but she did a presentation for SCCHWA earlier, and there were 3 key slides that I will talk about that she presented, just as a way to kind of affirm the power of the work that you guys are doing. And then in wrap up, I'll ask folks to provide a compromiso. You don't have to say it aloud, but I'll ask you to write down something that's a personal commitment, a promise for action that you will take in the next few months after this, as a result of this. As you said, my bio's in there, but I just want you to know that I'm representing 29 years of street outreach, of providing case management to adolescents living with HIV, and many other hats I've worn over the years. I was born and raised in Roxbury, section of Boston, where I spent most of my life there before moving to Central Mass for about 15 years, and then moving to Atlanta. I started at a community health center and a street outreach drop-in center. I also focused my work on community health workers. Then I moved to a community health center and a children's hospital, where I really honed some of my skills related to community and clinical linkages, which again, is a key, powerful point of our workforce, or attribute for our workforce. I've been engaged in many, many years in developing local, state, and national CHW networks, associations, and policies. And part of that comes from being the son of an anti-poverty warrior who was also a state representative for about 30 years. And so my mom instilled in us the civic engagement, the connection, and to the community, and our commitment to making change and making positive things happen in the community. I will also tell you one thing about the CHW movement. That's how I met my wife. I was in the eastern part of the state. She was in the central part of the state. And as some of you all know, sometimes they have moats that separate the states, and people are scared to go across those moats, and the drawbridge is sometimes up. And so I probably would not have met my wife if not for developing the statewide association in Massachusetts, which we were both founding members of, and then she became our first executive director. So I want to give kudos to the motivation of the missus to help me in my journey. So I have to take a breath, folks. All right, so the world is small, right? We all know this. We say this to our young people. We experience this in our lives as we travel, no matter where we go around the world. And as the CHW movement in South Carolina grows, and as the association grows and sustains itself, I want you to please continue to tap in to the energy and the spirit of the many CHW leaders in your state, your allies and partners in your state, and also regionally and nationally. We're here for you, we're here for each other. And that's critical importance as you embark on this first inaugural conference, as you look for many more to really tap into those national folks and connections. So I thank you all for inviting me today. That connection to CHWs around this country and world has been the energy that has sustained me. It's been the wind for my sails. And I really urge people to tap into that energy. You are not alone on this journey. We are all connected, and the association and CHWs in South Carolina should strive to strengthen those connections with each other and with CHW associations and networks across the country. Now, I say it's a small world and we're all connected. Just for many years, I was a volunteer on a historical Black college tour that my mom actually founded back in 1978 when she was with the Anti-Poverty Agency. So for about 19 years, I took a busload of high school kids from Boston, and for 2 weeks, and this was other people's high school kids. Now, picture that, on a bus for 2 weeks, hotels, visiting 17 historical Black colleges in 7 states each year. One of those states we visited was South Carolina, and we would visit Allen and Benedict. One of the staff members had family there, and I don't know if folks know the Harrison or Cook families in South Carolina, but we would get in the back of the truck sometimes and just drive around to different family members' houses. So I can't tell you the street names. I can't tell you the second of South Carolina, not far from Allen and Benedict, but I have been on the streets of South Carolina. I've met folks in South Carolina, and I really appreciate and honor all of you all for doing the work you're doing. We also had young people who got involved in a program called Call Me Mister. I'm not sure if you guys know about that. That's around supporting young men of color to be teachers. It gives them educational as well as academic support. Started at Clemson, Jackson State picked it up. But that was one of our key reasons for going to South Carolina, because some of our young men on our college tour were able to take advantage of that opportunity and get basically a full ride to college with their commitment to teaching. And I know a couple of them stayed for many years beyond what they had to do their commitment to teaching in South Carolina, middle schools in particular. Windows of opportunities. I really just, over my 3 decades as a community health worker, I've seen ebbs and flows in the many windows of opportunities that have opened for community health workers. We've not always been ready to take advantage of those opportunities, but I see the tide changing, and this is a great time for building strong CHW-led networks and associations locally and nationally to truly make 2020-21 the year of unprecedented CHW workforce advancement and support. Julie said, nothing about us without us. That's been a rallying cry. Another rallying cry for myself and many others has been Kuji Chakalia. That's one of the Nguza Saba, principles of Kwanzaa, and that means self-determination. CHW self-determination, nothing about us without us, guides me. I hope it guides you and all of the allies who are working with you. Momentum is building. You are all part of the wave during this momentum, so please take care of yourself, your family, and continue to recharge as we need to sustain this wave and this movement, as I've seen them come and go. I wanted to take a moment. I really had to cut this down because of the time, but just to honor some of the past shoulders that we stand upon. There have been many national gatherings. You heard from Benita. Many of us have been able to unplug since the late 90s into happenings around the country. That has been critical as we've been building our networks, associations, and also our policies related to CHWs in some states. We have learned, we have not had to reinvent the wheel. People have shared tools, knowledge, strategies for advocacy, strategies for engaging leadership, strategies for finding resources. And so these national conferences, particularly Unity, was that place where we garnered some of that. We also started organizing organic meetings of community health workers coming together, similar to what probably happened as you built the association in South Carolina, where we got together in the evenings. We talked strategies about how we could work together. We connected CHWs who were in the same state, sometimes who didn't know each other before, who came to the national conference. So I urge the association to continue to support CHWs from South Carolina to get to those national conferences. The American Public Health Association annual meeting also was a place. It was, for a while, the only national place for CHWs prior to Unity to come together. And so we developed a strong CHW group within the American Public Health Association, which helped us kind of get into and connect with the broader public health community. And once again, as some people call us an emerging workforce, a new field, we know there's a lot of history prior about community health worker-like people for centuries around the world. The USA is really just getting engaged in this, honestly. And so the American Public Health Association has helped us heighten awareness across the public health community about us. We also developed something called the American Association of Community Health Workers back in 2007 and 2009, which was really our first effort to develop a truly national CHW association led by CHWs. We ran out of steam, and so that's a lesson learned to everyone. You have to keep things flowing. You have to find the momentum and the people that can help you go. And so we weren't able to do that, but many of us who were involved in SCCHWA were able to also be part of the experience of the National Association of CHWs. And so I think that those lessons learned helped to sustain us long enough to get going. And you will be hearing more about SCCHWA over this next year. And so I hope that everybody learns more about SCCHWA, and Julie can help you with that as well. So I'm going to just run through some of these. I can't see the chat, but I may be being told to hurry up. So put a thumbs up if that's one of them. So over the years, right, all kinds of things have happened, national meetings that have come together. So I've already established that. These have been instrumental in building and being building blocks for our profession, and I hope everyone here gets to engage in those. There's also been more and more building national recognition. So these are just some of the organizations that have actually had policy statements supporting the CHW workforce. And once again, this is just a sample, and there have been many more over the last 15 years. For networks and associations around the country, when we put together the Massachusetts Association of Community Health Workers, there were about 5 networks around the country in the early 2000s. Now there's over 48, including your association. SCCHWA is trying to ensure that we connect those associations, and also some of those associations have been instrumental in working around issues around credentialing, certification, as well as financing sustainability. We've also been able to really raise some foundational work, and I really want everyone to understand this, and I'm saying this because it was going to be my job today to ensure that all CHWs, all allies in South Carolina know you are part of a bigger profession, a bigger movement. And so we have truly built on the qualities of community health worker, some skills, roles, and competencies that have been foundational to the enhancement of our role within community and clinical settings. You all have heard about the Community Health Worker Core Consensus Project, CHW Core Competencies. So now we actually have a national platform where others can recognize that we do have a scope of practice that is recognized, and that is the foundation of many of CHWs. Also, part of my title is around the connections to the community served. This qualities of CHW word cloud really depict that community has always been central to who we are, no matter where we work at and who we work for. This is what we're about: helping, supporting, advising, guiding, and providing assistance to our communities, but not just that, to ourselves and our families. We must not forget to serve ourselves and our families first. Health equity is at the heart of our practice, and I will just fly through these because of time, but we don't always connect the work we do day to day with achieving health equity. So I urge people, encourage people to continue to shape the work you do and the role that you have with a health equity lens. So this is one of the slides I borrowed from Julie. I just have to say, I applaud you. Your mission is critical. Your vision is awesome. Please continue to work. Oh, and you all look beautiful, by the way. One thing to note, James and the other men on this, I applaud you. The women rock, the women rule, the CHW promotor, the CHR world. We are trying to build our numbers, and we need more men, and maybe some of the fatherhood coordinators from Healthy Start and others can join our ranks. We need more brothers involved in this movement. And when I say brothers, I mean men, the brotherhood of men of all colors, creeds, and nationalities. These major areas of focus that you have here, this is what it's been all about for many of the network associations around the country. If this is what you're framing and shaping all that you do, you all are on the right track to be a strong, solid association that will make a major impact on the lives of everyone in South Carolina. Ambassadors, the SCCHWA has some ambassadors. I thank you all for stepping up to play that role for the association. That's critical as we reach out for resources and as we try to sustain ourselves. And thank you, Julie, for those slides. And then finally, this is why we're here. I mean, this is what it's all about. We are investing our time, our energy, our knowledge to support community health workers and compromiso. So this is my information. My wife has taught me well over the years to ask people for something. The something is this. I think Benita mentioned something earlier about everyone having a takeaway from this conference, of one major takeaway. I'm asking everyone to create a compromiso, a personal commitment, a personal action that you will take as a result of this meeting within the next few months. I urge people to take a moment during today to write it down and then revisit that in a little while to see if you've accomplished that. But I urge everyone to at least take one strong action as a result of this. I'm sorry that my time is short. I am so amped up to be with you, to be here for your first. And just so you know, Texas will be having their first statewide CHW Association conference coming up in September. Nashville will be having its first annual meeting in 2 weeks. So this is a wonderful time for first. I thank you for helping, for having me be part of this first experience. Thank you very much. I will stop sharing and pass the microphone back to the host. Thank you all so much for your time.
That is awesome. Thanks. Let's give Mr. Durell Fox a great hand for sharing all of that with us. The history, the love story, the work that you've done over the many years. And you know, we want to thank you for your lifelong personal commitment to being an advocate for making our communities healthier. Also, one of the takeaways, I think, you know, adding the national relevancy and the connection of all CHWs and their work across the country and the world, that's something that is greatly appreciated. And of course, as you mentioned, the whole personal commitment and action as a result of what happens today, you definitely want to follow back up on that and know what everyone is doing. And I personally want to thank you for coming from Roxbury, home of the great New Edition. Okay. So,
that was my neighbors.
Yep.
Ronnie, Bobby, Ricky, and Mike.
There you go. I think okay. At this time, we actually have another door prize, right? Okay. And my suggestion for that door prize was a 70-inch 4K smart TV. But what do we have instead?
Another wonderful gift card.
Yeah. Okay. All right. Well, that sounds great. And the winner is going to be Solomar Abbott. So Solomar Abbott, you have 10 seconds to come on down and show up in the virtual world.
I'm here.
Thank you, thank you, thank you.
You're welcome.
Thank you. Thank you.
All right. We're going to have we're going to pivot here for Centrell Thompson. Or are we going to go into the panel discussions? Do we want to panel discussions?
Yes.
Okay, great. All right. So we're going to have our panel discussions moderated by Ms. Terry, the very excited Ms. Terry Jowers. Love that energy. We're also going to have, let's see, along with her, Yahara. How do I pronounce that last name? You can see everyone listed on there that will be part of Terry's panel discussion. And so, Terry, I'm going to let you go ahead and begin your panel discussion.
Thank you so very much, James. And I appreciate the energy that you're bringing to today. We started planning this first annual conference about 18 months ago. And when it got called off in March, I felt like a bride whose wedding had been called off. I was absolutely devastated. So being here today with all of you, even though I can't hug you, which is exactly what I'd be doing, I'm just so excited. And Durell, thank you so much. Yes, yes. It just does my heart good to hear from a fellow community organizer. We're always looking to move people to take action, to create change. And amen to that. So by the end of this conference today, I want to know, I want to feel that each of you are making a commitment to take action, to create some change. And I've really been doing this with my family, first of all, to really challenge them to take action. And I've challenged them to think about it in small ways, right? Those random acts of kindness, maybe on professional, how we deal with folks, but on big things too. So nationally, how can we change? How can we take action? So thank you so much for that. I guess I'm supposed to introduce myself real quickly. Haven't quite figured out what I'm doing right now, but for many years, I live community health worker every day. Today, I've just added another title to that. So being a founding member of the board for SCCHWA has just been one of the greatest honors of my life. And to be to where we are right now, really on the precipice of explosion, has me so excited. And later on, I'll tell a little bit more about the project that I'm working on right now. I'd like to give a quick shout out to Guillermo Whipple, who's working with me on a men's health project, Durell. So we'll tell you all about that. And we'll tell you a little bit about our MASH project in Aiken, which is Men Assisting Sobriety and Health. But right now, I'd like to introduce two wonderful community health workers and let them tell you a little bit about themselves. And I've asked them to tell maybe some hot spots. What are some really big challenges that they're facing in their work right now? And what are some bright spots that they're seeing in their work or in their communities? If you have questions, please put them in the chat. We might not be able to get to them all today, but we'll save the chat, and if we need to, we'll reach back out to you. So Romaine, I'm going to ask you to start this conversation, please.
Hey, good morning, everyone. My name is Romaine Stevens, and I work with Family Solutions of the Family Solutions. Used to be Low Country Healthy Start, then Family Solutions of Low Country. Now we're just Family Solutions of SCORE. I've been working with community health workers way before the name was community health workers. Not sure if everyone knows, but our director is Miss Virginia Berry White. She's amazing. And I work with the most amazing people. We have nurses with Nurse Family Partnership. We also have social workers, and we also have the community health worker aspect of the program. So I am excited to be just a part of the panel on today. And you wanted me to tell some of our highlights of some of the things that we have been having.
Yeah, well, first of all, are there any big challenges that y'all are facing right now during the COVID period?
So one of the challenges that we face is actually not being able to have that direct hands-on service that we've been giving our clients for so many years. That has been a challenge because we are a home visiting program. We go out into the homes to assist our clients with what they need. And because we have been out in the community, we go out and do classes with schools. We go to different organizations to provide in-services. And so that's been one of the biggest challenges, not being able to physically see our clients, but we have adapted to those challenges by offering a lot of virtual sessions. So we would do childbirth classes once before in person, going to the different counties, and breastfeeding classes for our clients. But now we're having our childbirth class virtually. We're having our breastfeeding sessions virtually. And one of the good things about us being able to adapt, we have started doing story time with our clients. So they get to have us do different types of stories. We do stories, we've done paintings with our clients. We've also had exercise and had them to get up and move around. We try to bring in some Spanish activities to try to teach them their colors, the children their colors in Spanish. So we had books not only that were done during our story time that was English, but we had someone to come in and do the book in English and Spanish. So prior to this, our challenges, we didn't do as many activities that we're doing now. So now we're able to reach out to a wider variety because we have our clients that's already a part of the program that we were offering the service to, but because we're doing a lot of activities virtual, we're opening it up to everyone. So even though that has been one of our challenges, it's also been one of the things that we have adapted because we are highlighting our men. We started doing some videos to get our fathers involved. We asked our clients to send pictures of their dads, just doing different things. They could be feeding the baby, outside playing with the baby, or running with their babies, doing exercise. And we took all those videos and we made a collage to say, Dads, you are essential. We need you. You're important to the family. So that's one of the, it was a challenge not being able to get with them, but it also became like a really good blessing because we are able to honor them during this COVID season and do different activities that will bring families together.
Romaine, that is absolutely amazing. I'm so excited to hear this. And I love the creativity that is coming through Challenge. Awesome. At some point, maybe you can put this in the chat. If you can talk a little bit maybe about what are some of the challenges, like was broadband a challenge? Did your folks have access to computers and those kind of things? I know you work in rural areas like I do.
Yes, and so that's still a challenge for a lot of people in the areas that we serve, even our workers. So even though we have the access to having like hotspots that we can take with us, even some of the places that we go, the hotspots don't work. We may take our Wi-Fi box and say, okay, well, yeah, so that we can have internet anywhere, but that's still a challenge because some of the cell phones don't work in certain areas. They're working on that, but that's something that is going to be a challenge. And even as the parents their children go back to school and they have to do some of that virtual learning, they are experiencing some challenges with that as well. But I'm believing that it's going to work out really well.
Thank you. Y'all just absolutely rock. And I got a call the other day that actually tore my heart out. I got word that Virginia Berry White is retiring. I don't know what South Carolina will do without her. I'm devastated to hear it, but thank you so much for all the great work that you all do there. Yahara, how about introduce yourself and tell us a little bit about what you've been working on and what your challenges are, and then maybe some of the great things that are happening there.
Sure. First of all, thank you. I'm very excited. I'm enjoying this mini conference, so thank you for inviting me. My name is Yahaira Bene Uzcategui, and I work at Beaufort Jasper Hampton Comprehensive Health Services. which is affiliated to PASOS, to make sure that the patients that come to the clinic are supported and connected to services and resources. I came to be a community health worker a little bit by accident. I moved to South Carolina in 2009, and I was looking, of course, for work. And during that year, there was a freeze in hiring, so nobody was hiring. And I went to volunteer with the Beaufort office of DHEC. And through Caroline Jenkins, who was then the director of CRS, Child Rehabilitative Services, here in Beaufort, I heard about this organization, PASOS, that worked with Latino families. And I applied, and the rest is history. I've been with PASOS since 2009, so it's been 11 years. I love being with the organization. And right now, what is exciting is the connection that we're having with the clinic, with the FQAC, where we are inside there to make sure that we support the families that live here. You asked to talk a little bit about the challenges that Latino families, immigrant families have now with COVID. And actually, sadly, this week, one of the husbands of a participant of ours died due to COVID. And he died at home, and he died, and his children and his wives were present when he died. And that brought us to come close to the family, because we know them, and to ask why they did not seek help, why they didn't go to the doctor. And with talking to the wife, to our participant, she said that they saw that other neighbors where they live were getting sick, but they were recuperating, and they hoped that, you know, that was going to happen to them also. So for us, that has been very hard. I think some friends also were asking to go to the hospital, and the husband said that he didn't want to go. He didn't want to have a tube put in him. So it made me think, you know, the information is out there. DHEC, CDC, they've been very active at having information in Spanish. We have been sharing the information. But to me personally, this situation made me think about, even though we work so close to the community, what have I missed? I think that was the feeling that I had. What did I miss? Why this family did not feel like going to the doctor? Why this family did not feel that there was help for them out there? And it's been a tough week thinking about that, and making us think again as community health workers how perhaps the reality, my reality, is not the same as the reality of those that we work with. So from this, what's happened is come out other ideas about perhaps thinking at other things that I had not really thought about. Immigrant families don't receive a stimulus check. Immigrant families need to work because they cannot receive many of the services that are out there to help people during COVID. So they have to go to work. So I know that now one of the things that is happening from that, I want to make sure that perhaps we have a PASOS live session where we talk about the importance of going to work, because they need to work, we need to work, and perhaps maintaining safety and security while you are at work, keeping, you know, washing your hands, keeping a safe distance, perhaps not having lunch with others, because, you know, our culture also is very close. We, you know, we like to celebrate very near to each other, and perhaps sometimes being apart and not being able to give a big hug is difficult for us. So that's one of the things that had been challenging, and that still is making us think, you know, to do things a bit different. But there's been some good things also. There's been some highlights. The fact that the clinic has been open for us, it has been very important. The fact that we can still serve those in the community that need it means a lot to us. And another thing, like I said, what is coming, thinking of new ideas. And something else that we started kind of as a need was provide, because we have a lot of prenatal women, we help with the Medicaid application. And before we had to go home for COVID, we designed a plan on how to do it without having any personal contact. And you were asking, Terry, about something that surprised us. And actually that's something that I think that we may keep, because we're in a rural area. Even though there's spots where there's high population, to come to the clinic, it means to pay $30 to someone bringing you in. So the fact that now we can have participants sign the Medicaid application and then do it over the phone has been really something that has made a big difference on families. They don't have to stay here longer. If they're paying someone, they can go right away home. And it's making a better use of their time, because we can do it when it's convenient to them. And that is important for us also, because we all know as community health workers the many barriers that families encounter. So I think that that has been something that we did different because of COVID, but I think it's something that it surprised me, but we may want to implement and continue just because it's convenient for those that we work with.
Yahara, thank you so much. I mean, we hear the numbers, we hear what's happening in the Latinx community, and your story just brings it all home for us. And I love the fact that you said, like we all do at times, what did I miss? What did I miss? I would just say that, it's not you, all right? It's not you. It's we as a community. It's what we as a society have missed. And I think that this again is one of those call to actions, one of those things that we need to step up and say, it's not right to have this kind of disparity in communities of color. And we just have to do better at this. Thank you so much for your commitment. I love the fact that you brought up this bright spot about rethinking things like how we do Medicaid applications. You're exactly right. If somebody's got to pay for transportation and for a babysitter to come to an office just to fill out an application, that doesn't make sense. It really doesn't. So thank you, ladies. Y'all are awesome. I say this all the time. I feel like I'm the most blessed person in the world to get to work with the most wonderful people in the world. I love community health workers. Thank you so much, all of you, for what you do every day. Remember, if you have questions or comments, put them in the chat and we'll come back. We'll try to follow up with those later. Thank you, ladies.
I know this is not a part of the program, but I want to say thank you to Romaine and Yahida. Thank you so much. Appreciate your time.
Definitely. Thank you all. Thank you, Terry, for handling that panel discussion. And it is time again for another amazing door prize. I know we all like to win something. Were we able, Benita?
Yes.
Were we able to?
We have a name.
We have a name. All right.
Absolutely.
And that name?
Would you like for me to announce the name?
Yes, I would like for you to announce it.
The next winner is Miss Centrell Thompson.
Ah, okay. So
Centrell.
You have 10 seconds. 9.
Yeah, she's here.
She's here. Oh.
All right.
Yeah. If no one, if someone.
I am here.
There you are. Awesome. And would you like to tell Ms. Thompson about her prize?
Guess what it is? It's a wonderful gift card that will be emailed to you. Let me tell you, if COVID was not around, I would personally drive them to you, each and every one of you. I miss being out there. I miss seeing everybody coming to Orangeburg, going to Beaufort, going to the upstate. I miss it so much. But yes, Miss Central, you get a gift card also.
Well, congratulations, Miss Central. Congratulations. Now we're going to have greetings from our gold sponsors. That would be Blue Cross Blue Shield of South Carolina, Molina Healthcare, South Carolina Thrive, and Care South Carolina. So you can kind of see that on your screen. Please, if you get an opportunity, and we should take the opportunity to thank the sponsors, because it's because of them that you're able to have the event today. And we definitely want to say thank you. That to me seems to be the least we can do. We want to move on to our breakout session. So this is going to be really interesting, okay? Because we have a lot of people and quite a few sessions. There's going to be supervising the community health workers, rewards and adventures with Merritt Calhoun, care teams, the value of CHWs bring to the community health improvement, Dr. Rick Foster, families in crisis, addressing addiction issues through Aiken MASH, and Your Health Matters Too, by Benita Clemens, who's our great executive director. So, Ms. Donna, you're going to break us out into our sessions?
We are ready to break out, and everyone, if you could please accept your breakouts. If for the leaders of the sessions, if you have any questions, just go ahead and go ahead and send that to me in the chat. So you should be appropriately broken out into your areas. Okay. Anyone have any questions now before we break out? Is that a question? All right, moving on to our breakouts.
All right. Wow. We had a very, very powerful discussion. I would hope and believe, I do believe that everyone probably had a great opportunity to express, engage, listen, share, and hopefully learn during our breakouts. So with that, we're going to have what we call a quick stretch, okay, with Jacqueline Hogan. Jacqueline, are you here?
Hello, I'm here.
All right.
Can you hear me okay and see me fine?
We can see you, we can hear you, we're ready to stretch.
All right. Well, thank y'all for having me. I'm thinking most people are sitting down, so we're going to do some seated stretches. I'll give you options to stand up if you'd like, but from here, let's just find a place where we're not sitting back in our chair like this, right? We want to sit up nice and tall. We want to stack our shoulders over hips and line our ears over the flesh of our shoulders. You can take your feet about shoulder hip width apart and just feel that connection, that alignment from your tailbone all the way through the top of your head. So just take a moment to just close your eyes. Take a deep breath. Exhale, let it go. You guys got a lot of good information to process, but just for a minute, let your mind clear out. Allow that stillness to take over and just notice your breath. right, let's go ahead and open our eyes. We're going to go ahead and just start with a few neck stretches. So let's take our arms either right down by our sides or maybe grabbing the arms of our chair if we have arms on the chair, and just lean over to one shoulder. Keeping the shoulders pressed down and gently tuck the chin forward, letting the forehead reach for the knees, holding there in the center. Take a breath. Inhaling to the other side, reaching over, and then tucking the chin forward again. Over to the other side, inhaling. One more time, exhaling, chin forward. Inhaling, ear over shoulder. And gently bring the head upright and center. So let's take our palms forward, reach our shoulders down and back, and we're gonna flow one breath, one move. As we inhale, sweep your right arm up and over, stretching through the rib cage. Exhaling upright. Inhaling up to the other side. Exhaling upright. I see one frozen screen. I hope you're still seeing me live. We're gonna keep flowing. One move, one breath. Good, let's go one more time to each side. Very good. And let's go ahead and take hands on top of thighs. And we're gonna do something called cat-cow. So we're gonna lift through our heart, lift through the spine, arch through the back. Exhale, round and rock back. Inhale, lift through the spine, almost come out of that chair. Exhale, round back. Good. Inhaling up. Exhaling down. One more time. Inhaling up. And exhaling down. Let's go ahead and come upright and do a few circles with our hips and shoulders. So you're going to feel your rib cage kind of go around and around like a jump rope, side to side. Letting the hips roll around in their sockets. Slowly go to the other direction. And then coming center, let's stretch through those hamstrings. You've been sitting a little while this morning. You want to take one leg straight out. Make sure your knee stays a little bit bent. You're going to take the same side, arm up. Inhale, reach. Exhale, sweep down and around. Reach for the toe. You don't have to touch it if you got a desk in your way, but just kind of go in that general direction. Inhaling up, exhaling, sweep. One more sweep, and then we're going to hold at the bottom. So as we're holding, maybe you find your fingertips on your toes, maybe it's on your shin. Wherever you are, you want to lift through that heart. Feel your back stay neutral. You're going to feel the back of the thigh, maybe back of the calf stretching. If you want to point your toe for a little shin stretch or ankle release, you can do that. Then lift that toe back up and slowly roll all the way up. Bring your foot back flat, and let's switch sides. So heel comes down, leg is straight. We're going to inhale that arm up. Exhale down and around. Sweep and inhale up. Exhale down and around. Inhale, sweep up. Very good. One more to hold. Hold at the bottom. Lift through that heart. You can drop that toe if you'd like. Then lift that toe and gently slide back. Let's do one more stretch for our hips. Our glutes can get very tight. That can be very troublesome for our sciatic nerve and low back. So let's make sure we stretch those glutes. From here, we're going to take one ankle and cross it over the thigh. You want to make sure that your heel stays under the knee to support the joint. So we're going to let that knee fall out to the side and remain open. Sit up nice and tall. If this is enough stretch, you feel that glute or that hip kind of releasing, you can stay there. If you have a little bit more room, you can hinge forward at your hip. Some of you may be able to lay your chest across your leg. By all means, have at it. We want to keep our shoulders pulling back and down so we don't get the round in our back. This is called seated pigeon. And there's several ways you can do this, but for now we're going to do it in our chair, but you can lie on your back and do it. You can also do it on a yoga mat or standing on a couch. Not on the couch, but with your leg up on the couch. So remember to breathe. Take a couple more breaths here. Slowly unhinge and uncross. And let's go ahead to the other side. Pick up that ankle. toes pointing forward. Relax that knee and hip. Sit up nice and tall. Breathe, relax. And if you've got a little more space in those hips to release, hinge forward. You might find that one side's a little easier or a little more challenging to do, and that's okay.
Am I supposed to be able to do this in jeans?
It's a little restrictive, yeah, but you can hike those jeans up and get a little more room in those hips.
Okay.
All right, I just want to leave you with one more stretch if that's okay. It's a nice full body stretch. Let's uncross. This one has us to stand up. So we're going to come to the back of our chair, or you can turn your chair. This is just going to be a standing down dog. Or if you've got a wall that you want to put your hands flat on, you can do that as well. But otherwise, we're going to take our hands to the back of the chair. We're going to walk back so that we have a little room for our hands to expand. And then we're just going to let our hips stack over our feet. And we're stretching those arms out. So we're letting our chest fall towards the toes, stretching those arms overhead as far as we can. Soft knees. Don't forget to breathe. This is really great to open the chest, the back, the shoulders. So for those of us sitting at a desk or having work, books, whatever in our lap, this is a really great counter to that movement. Let's take a few more lengthening breaths here. Very important to breathe while you stretch, to breathe while you exercise, and you need to hold your stretches for at least 20 seconds, at least. That allows our body to actually let go. Slowly, let's come on up. Walk towards the back of that chair. Maybe face forward and take one sweeping breath in with me, arms all the way up. And then exhale, hands to your sides. Hopefully you feel a little bit more relaxed, a little more stretched out. I believe my information is somewhere in your presentation, but feel free if you have any questions, comments, concerns, requests, you're welcome to reach out to me. Thank you so much for having me today.
Thank you, Ms. Hogan.
You're welcome.
All right. Everybody feel a little better? Working on neck stretches? Okay. All right. Guess what? It is time for our $20,000 door prize. Do we still have that one? Okay, well, let me tell you. Let's see. Oh, no, it's another gift card. That's okay. All right, the winner of the next gift card is Guillermo Whipple.
I'm here.
Hi. You are the next winner.
Yeah. You have an awesome gift card coming that can be used at any Walmart of your choice.
Awesome. Thank you.
You're welcome. So let's have a greeting from our silver sponsor. That is the South Carolina Department of Health and Environmental Control, otherwise known as DHEC. Do we have a representative of the silver sponsor? At least get a, there we go.
So I don't think we have any representatives
Right.
from Silver, but I did want to go back and make sure. I thought there was a representative that was from Blue Cross, and I did not have the specific name. So if anyone wanted to speak up regarding Blue Cross or any of our gold sponsors.
Hey, this is Marek Karasov. I just wanted to thank you all for allowing us to participate in the mini conference. The information that we've gleaned so far has been very beneficial, and we thank you for allowing us to be part of it. We build a good relationship and partnership with the association, and we definitely look forward to many more years of partnership and collaboration.
Thank you for that, Marek. I mispronounced your name earlier, but I got it now.
You good?
Good morning. Can you hear me?
Yes.
This is Rolanda Aiken from Blue Cross Blue Shield of South Carolina. And several of my colleagues from Blue Cross Blue Shield are also participating in this Community Health Workers Conference. We are very glad to be here and excited to learn more about the community health workers and to provide support. So just want to say thank you again for the invitation.
Well, thank you for letting us know that, Rolanda, and we definitely thank Blue Cross Blue Shield for being a gold sponsor, all of our sponsors, and we appreciate the participation, not only just the sponsorship, but the participation with today's session. Any others? All right, we're gonna, after that great stretch and door prize, we're gonna move on to credentialing community health workers. And
Wait a
Terry,
minute, James, but was it just that one?
yeah.
Okay. Okay.
And so Terry, are you ready?
Well, I'm here.
Okay.
Is Melina? Who's okay?
Just on the credentialing, credentialing of community health workers.
Okay, here we go. All right. So this is a long story. I'm going to try to make it fast. When in 2011, Healthy Columbia started our work in the community in Columbia, and one of the things that we heard was that I just love was so we really want to have healthy neighbors and healthy communities, healthy congregations, and we're happy to volunteer to do that. But what if we had folks who actually were trained and got paid to help their neighbors live a healthier life? And so we put together this little group that started kind of researching that, and they came up with community health workers. And of course, there were already community health workers at that time who, back in the PD, they've been working as resource mothers since like 1993, I believe. Family Solutions, they were also had folks like community health workers, PASOS, but there wasn't a credentialing process in South Carolina. And so Katora Campbell, who was on our committee and eventually went to the tech school and said, we found a great curriculum and said, would you teach this? And at the end of this, then people would be certified community health workers in South Carolina. So that started in 2012, and it became kind of the de facto credentialing process in South Carolina. Gosh, that seems like a very long time ago. And so much has happened since then, particularly for community health workers. And so there are so many things that we didn't think about in 2012 that along the way it became kind of urgent issues. And so in 2018, Blue Cross, God bless you, Foundation of Blue Cross Blue Shield South Carolina Foundation funded a strategic plan, needs assessment strategic plan. And one of the things that really came out was that we had to update our credentialing process. And so we had stakeholder buy-in. We formed the South Carolina Community Health Worker Credentialing Council. And I'm seeing Lena and Rolanda from Blue Cross, many other folks, and I could name them all, but our motto has always been, we have to have, our philosophy is 51% community health workers. So 51% of the folks who serve on the Credentialing Council are community health workers. We have representatives from Blue Cross, AHEC, DHEC, and DHHS as well. But a lot, so our work was really to establish what the core competencies were, and we had some in South Carolina, but we've updated those. And then we developed what we felt like were new standards that we needed to come to. And so those standards now are that you have to have 80 hours of classroom instruction and 80 hours that meet those core competencies, and pretty much roughly 80 hours where you demonstrate those core competencies. And so I want to say that on the Credentialing Council, Scott Thorpe, who is not only serves on the board of SCCHWA, but also works at DHEC, has been appointed. He was the facilitator or chair for the Credentialing Council, and Scott has been named Mr. COVID for all things in the Midlands for DHEC. And unfortunately, he's recently had to step away from the Credentialing Council. So I'm stepping up and on a pinch hit here. We'll be meeting soon to elect new leadership. But I think a lot of things have happened in a really short amount of time, and yet the urgency feels like it's growing exponentially every day. So currently, we have 2 trainings that have been approved under the new system. One is through the Community Health Worker Institute, which is a part of the Alliance for Healthier Communities, Community Health, and then one from PASOS. And PASOS hasn't actually done theirs yet, but they're working on it. The other training we've actually done twice now in the state, and we're working on figuring out how to do practicums and a test virtually. So these were things that we just didn't anticipate when we first started. Other pieces of this, the Credentialing Council is going to be considering having, helping South Carolina community health workers develop a pathway or a career pathway. And so maybe there'll be tiered credentials. So there might be community health workers 1, 2, 3, something like that. And those might be based on not just your initial training, but your years of experience and ongoing continuing education. We're also looking at credentialing advanced placement. So you heard Julie talk about that they were going to be offering additional training. So we really want to make sure that those are out there, and that all community health workers in South Carolina are growing all the time. For the first time, we are also going to have continuing education requirements. So certified community health workers will be required to have 20 hours, I think it is, over 2 years of continuing ed. And you'll document that. You'll see in a little bit how we're going to have a registration for all community health workers, but you'll need to be able to document your work. So I'm so excited and sorry that Scott couldn't be with us and had to step away. I thank all the volunteers for all your hard work. We really appreciate it. If you have any questions about training, if you feel like, gosh, my organization needs to have a training there, reach out to me. We're happy to, if you have thoughts or questions, please feel free to reach out to me. And we're gonna make South Carolina community health workers, the best trained, the best supported in the country.
Well, thank you, Terry, for that. I think everyone would agree that definitely going to make us the best in the country, and we will become the gold standard, not just the standard, but the gold standard for community health workers across the country. At this time, we're going to have, let me see here, Miss Donna Mack to do introducing the South Carolina Community Health Workers Portal, our very own project management professional. Ms. Mack, you ready?
I really like to be behind the scene instead of in front of the scene, but we have a awesome community portal, South Carolina Community Health Workers Portal, and I'd like to just introduce it and make sure everyone knows how to get on. We've had some people actually joining already, so that's great. Thank you for coming in and logging on to the portal. So we will actually be looking at some of the additional items in the portal. And does anyone know why this would be a great thing for us to have? And you can speak up.
Well, for one, the association needs to know who all of the CHWs are in South Carolina. We know that there are different names, but if you're doing the work, we need you to please sign in. You got to be counted. We need you to be counted. Don't get left out. We need you to be on this train. We need you to register.
I was just going to say, I think too, there's more power in numbers. So if we can have everybody register and be able to say how many hundreds of community health workers we have in our state and make sure everybody's part of the association, we can do more to advance our workforce together. So I also just encourage everybody to fill that out and be part of the registry if you're a CHW in South Carolina, and pass that on to other people. And just one note, it doesn't mean your title at your workplace has to be community health worker, because we know that a lot of people have different titles, but their scope of service and their qualities are that of a community health worker. And so we want everybody to fill it out, even if you have a different title at your job.
It's going to also make it easier to connect and network and glean best practices from some of your peers.
Excellent, thank you. Those are all great, and those are actually the correct answers. Give you all A's for that. So this is how you access the portal. If everyone sees my screen, right there in the center, we added a link, CHWA's portal, and that will take you to this login page. So as you see, Benita has already she's already logged in. She's already there. And for those of you who have not, you're going to go out there and press this create new account. And I'm just going to show you a couple of the screens that you will see. It's actually pretty, and Darren, yes, I did use you as an example. So as you see, it's just asking for some general information about you. And also it does ask you about your zip codes. And in this demographics, the zip codes here, you see he has 3 of them. Those are 3 zip code areas that he would service as a community health worker. So we asked for just information, as Marek was saying, this information kind of allows us to have information on all the community health workers throughout the state. We know that we have a number of them that have been identified, and those community health workers, just knowing where you are, we know where you are, and we also know where we may need some additional community health workers. So this is very good information. Just yesterday, I was talking to Benita. I called Benita. I said, hey, do you know any community health workers in Lancaster? Because I have a friend who needs one. He doesn't have access to insurance and he needs to get some health care. And, you know, I know this type of information or this type of database would be able to house that information and we could quickly access it and give it to others. Another part of this is for your credentialed health workers. You will enter your certification information and you'll actually be entering when your cycle, we'll have information about your cycle as far as your credentialing. So are there any questions?
Donna, this is Rick Foster. Can you hear me?
Yes, I can.
I think this is wonderful. And you kind of touched on it a little bit, but in addition to the internal value of the ability to connect each other, I think for a lot of the organizations that are both public and private that are going to be important for you to work with, having this central contact point, whether it's to say, do you know of some individuals that are community health workers in a particular community, or if there's a need to communicate some important information, the more you have that central point of contact, it'll help all of those who have gone into that portal, but I also think it continues to create more visibility around the association and its members. And I very much appreciate Julie's comments about the fact of whether you're called a community health worker in your particular role, having a central point for all those who do community health worker work is going to be extremely important, because we still have confusion, I believe, about these various terms and names. And this may be another way to create more of a centralized awareness and access to everyone who's doing this very important work in the community. Thanks.
Excellent. All right. So I do know that recently one of the candidates for president was in the state, and he mentioned the essential work that community health workers do. So this is a way that we can all be identified, and the synergy that we get working together makes South Carolina community health workers stronger. Thank you.
Thank you, Donna, for that. And the portal does look great. Did you design that?
No.
Oh, okay. I know you have that background. So we're going to have a word from our bronze sponsors. We have 4. That's Spartanburg Regional Healthcare System, Roster Health, the Center for Vein Restoration, 5, South Carolina AHEC, and the Family Nurse Partnership video. That's a video. Do we have any representatives from any of our bronze sponsors?
I'm here from Center for Vein Restoration. My name is Joy Kaufman.
Good morning, Joy.
Good morning. Thank you for having us. I think Dr. Reynolds is going to join as well, just to introduce himself and say hello. And I think we had 2 slides maybe for our center here in Columbia.
You did, and my apologies. I think I had to redo the slides. So Joy, I will put those in there. I got you. All right.
Sounds good.
Well, we definitely thank you for, again, the sponsorship, but mostly for the participation.
Well, I would like to say, well, thank you for helping us learn a new way to support the community. This is my first virtual mini conference, and we're always looking for ways to be involved in the community and help other healthcare providers. We've been treating veins in Columbia since 2004, and sometimes that feels like a really small world. So we like to look for new ways to get involved, and I can honestly say I have learned a lot through this this mini conference. I did not know you could do so many things with Zoom.
Oh, you can. There's probably even more, but we appreciate it. And thank you again.
Thanks.
And I'm Central Thompson with Nurse Family Partnership.
Yes.
And we actually are so excited to be here and represent it today. We do take care of South Carolina's most prized possessions, and that is the unborn and beginning lives that are going to be leaders of our country. And so we bring you greetings and thank you all for allowing us to participate.
Thank you for participating. Thank you for being a sponsor, and definitely thank you for your work.
Good morning. I'm Lisa Renee Holderby Fox, and I am representing Roster Health this morning. And as a longtime CHW, I just want to echo what everybody said today and congratulate the association for all the work that they've done and the work that they will be doing in the future. Congratulations.
Well, thank you. Thank you, Roster Health, for your sponsorship and for your participation. We look forward to a long relationship and watching it grow.
Joe Ward, I'm with the South Carolina Respite Coalition, and we're glad to be part of the group today. And we're a nonprofit serving the state, and we work with family caregivers to give them respite breaks, which are just really temporary short breaks for those that are caring in their homes for someone with a disability or special need or some kind of chronic illness. And we support that and through a number of ways. The main thing that we do, though, is provide vouchers to help pay for respite care. So we're glad to be part of this, and if we can ever help with anybody on the community health side, please let us know. Thanks.
Thank you, John. And I've actually had family members to call on respite care for assistance. So it's something that we did not know about until we needed it, but it was very, very helpful to give our cousin a break. So that's just my personal story. But thank you for your sponsorship.
Behind most great people, there's usually a great mother. A mother who loved, supported, and provided for her child. They are weighed down by the burdens of circumstance. Isolation, abuse, poor health, and extreme poverty. These mothers seek support to realize their motherhood. This is not a mere intervention. This is a revolution. A revolution that's creating a better world. A world full of great people raised by great mothers. Since 1971, Nurse Family Partnership has been on a mission to help first-time parents succeed. Since 1996, we have supported over 280,000 families across 41 states, the U.S. Virgin Islands, and tribal communities. But our work is far from over. We envision a future where all children are healthy, families thrive, communities prosper, and the cycle of poverty is broken. We can't do this. Every day we show up to work, we aren't doing just a job. We are creating a better world, one family at a time. A better world start with great mothers, and great mothers start with us.
All right. Well, the sound was a little off there, but I think everyone got the message. And the message was the most important part. Again, we want to thank Nurse Family Partnership for that video and for what they do. Is the doctor available from Center for Vein Restoration?
He is. Dr. Reynolds just joined and was just going to say hello and introduce himself to all the
live their life with joy. So we want to do everything we can to help individuals and organizations in the community, and please call on us whenever you think we can help.
Thank you, Dr. Reynolds. We appreciate that. We love the fact that you chose to participate with this organization, and we look forward to other opportunities. So again, thank you for the sponsorship. Thank you for the participation.
It's our pleasure. Thank you.
All right. We're going to move over to where we can come to our senses. This is going to be very interesting. Dom Francis, are you available?
Yes, indeed.
There he is. Mr. Dom Francis with the University of South Carolina Arnold School of Public Health, the training coordinator for the Center for community health alignment. How did we come to our census?
Awesome. So if you noticed, we've been given a little inflection to that word census, because we're not talking about coming just to our census as the euphemism goes, but think about census in terms of Census 2020. So I come to you all wearing not so much my training coordinator hat for the Center for Community Health Alignment, but I'll be coming as a member of the Columbia Complete Count Committee, which is a committee that Mayor Steve Benjamin in Columbia wanted a committee to be constructed, and our co-facilitator or our co-leaders, China Phillips and Kayla Millette, head that committee, and a new addition, Rania, gosh, her last name escapes me at the moment. On that note, though, what I will say is a lot of things have changed, and so I originally even had a PowerPoint that I want to share with you, but some of those things are a little obsolete now because of what's been going on with the census. So I'm going to give you guys some information, and what I am going to ask is that everyone feel free to either be active in chat or you can unmute yourselves. Those of you who have interacted with me before know that while I love to talk, the one thing that I might do more is try to get you to talk to me. So please just stay engaged. I appreciate y'all giving me your time and attention. So we kind of already gave away what it's about, but I just want to open with this question to set the tone. Either use your reaction like the hand clap, or maybe a thumbs up, or maybe you comment in the chat or verbally, whatever you want to. I just want you to respond and tell me how many folks here feel like they could certainly use more resources to support the community they serve. Yep, I see the screen lighting up. I see the snaps. I hear the claps. I see the claps, the thumbs up. Exactly, we definitely feel that way. And I just want to ask that question to set the tone. So the follow-up to that would be, how many folks have completed their census survey? Same thing, however you want to respond. Good stuff. The screen is still lighting up, and that's what I like to see. That is exactly what I like to see. And so then the next one I'm going to ask, like I said, I love to hear from you all. How many folks have also encouraged those around them to complete the census? Yeah, either we might have slowed down a little bit because I'm asking too many questions, or nope, there we go. We have it, all the yeses. Maybe I just wanted to see a bunch of hand claps and yeses on my screen so I can feel better about myself on this Friday. Who knows? No, but on a real note, I appreciate all of you answering that much. So on that note, I just wanted to show you all, here I'm going to share my screen, wanted to show you all what the census completion rates look like right now for South Carolina specifically. So I am going to share this screen. Can everyone see my screen? Some head nods. Beautiful. So what you'll see here is if you go to the census, the 2020 census website, South Carolina right now is, oh no, I don't want Alabama. I was just on it. The South Carolina right now, while I'm pulling that up, is at 57.6% completion rate. And y'all, just want to let you know that's, I mean, it's a completion rate, but it's not necessarily what we want right now. Let's see if my screen is going to cooperate with me. If not, luckily I remember a lot of these numbers. I won't fool too much with this because apparently my laptop doesn't want to cooperate with me at the moment. But anyways, here you see the national response rate is, oh, there we go. There's South Carolina. South Carolina response is 57.6. So let's click on South Carolina. You see a lot of that's been done via internet, that's 42.7. We've had some talks about how in certain places folks don't have internet, but I won't go down that rabbit hole during this session. So as you can see, also the final count for 2010, the response was 64.7%. So we're looking at not even getting 70% completion rate as it relates to the census. These last 10 years, and it looks like we might not get there this time because the census timeline was originally extended to October, but it is now going to be, the self-response is going to end in September. It's actually going to end at the end of September, September 30th. So we have a lot less time to answer the census. And so that question I asked at the beginning might have seemed a little bit irrelevant unless we know the importance. Does anybody want to put in the chat or even verbally tell me, why is the census so important? Why is it important that we fill that out?
Allocation of federal resources.
That's right. Allocation of federal resources. Funding for the state.
Funds.
All right, we hit the nail on the head, definitely in a very general and encompassing way. Somebody give me something specific that money might go to. Specific program, maybe.
Schools.
Schools, that's right.
Hospitals.
Hospitals, yep.
Disability services.
Disability services, public education, healthcare, SNAP, grants to help all sorts of things. That's right, y'all. So I'm actually going to read this right up I have because I'd hate to get it wrong. So despite the fact I probably could do it without rehearsing, we just like to stick to a specific script. So the top 10 census-guided federal programs are SNAP, Highway Planning and Construction, Medicare, Medicaid, Section 8 housing, Title I grants to local education agencies, National School to Lunch Program, special education grants, CHIP, you know, the state children's health insurance, and Head Start and Early Head Start. Y'all, those are the top 10, and folks named a lot of them, but that's the top 10. There are dozens of programs that are funded by the information given from the census. And so approximately $675 billion in federal fundraising is distributed to communities throughout the country each year based on census response. $675 billion. And so if you do that math, that's a little over $1,000 a year in South Carolina, at least over $1,000 a year is given for each individual that responds to the census. And notice I said each individual that responds to the census. That doesn't matter if you are considered a documented citizen or otherwise. And the way the census work is the data is actually randomized. I can't give you too much on that, one, because it would take a while to explain, and two, because I'm not the best person to explain. But what I will say is there's a great deal of effort invested in creating white noise around the data so that they can pinpoint what responses come from what areas, but they're not going to be able to say specifically what individual responded when to what information. And Benita is getting me right to the point. What can we do? And so on that note, I want to say there are a few things that folks can do. The biggest one, and what is white noise? So white noise, in short, is basically the way they collect the data. They gather a group of epidemiologists, statisticians, a number of experts from a multidisciplinary team, and collect the information in a way that allows them to get the pertinent information they need, i.e. how many folks need to be counted, without necessarily putting specific names to who gave that data, if that makes sense. So whether you are documented or not is not necessarily, actually it's not something that they should be able to determine from the census based on the way they collect that information. There's actually several parameters within the census, and I wish I remember the explicit clause, but you could serve up to a lifetime in jail for trying to figure out any descriptors related to a person completing the census. So if you're like, so-and-so completed this and said this about their household and what was going on, you can get locked up for that. The government is very intentional about making sure that confidential information is not shared. So on that next question, Benita, you said, what can we do? The biggest thing I can ask for everyone to do is make sure that you fill out your census if you have not. And if you have filled out your census, please, please, please encourage those around you, because I feel like we all know folks who have not filled out the census. I'm sure we all do. And on that note, I just encourage everyone to, if you know those folks, if you have any sort of relation with them, encourage them to fill it out. Explain to them the importance and how much money it's worth, the resources that are able to be offered through that. Again, think about that, y'all. That's $1,000 a year. The census only happens every 10 years. So for 10 minutes of saying, hey, I live in so-and-so area, I have this many people living with me. Thank you, Kim. Very easy and quick process. For approximately 10 minutes, you're talking about $10,000 over the next 10 years for one person. Is there a public announcement that we can put on social media? What I'm going to ask, and that is a great question, I'm sure there is, and I don't have quick access to it, but I know I can put y'all on folks that do. Yes, so if you go to SC Count Me In, and let me make sure, one, that's contact for if y'all want more explicit calls to action other than just filling out the link, or filling out the census or sharing the link. That's what I had. The link I just dropped in the chat will let you ask other ways you can help. But if you go to the home page, there is actually, is it the home page? Or is it the contact us page? We have social media. If you go to SC Count Me In on Instagram, Facebook, Instagram, Facebook, or Twitter, I believe we also have. You can go to any of those places and there are updates and information about the census marketing, census videos. And again, if you want to make a direct ask or talk to somebody about how you can be heavily engaged, that link I showed you will directly link you to who you can get involved with. But SC Count Me In. And while that is driven, can we as CHWs support our families? Let me finish my sentence. I do that very easily. You can go to the social media while I'm talking about Columbia Complete Count Committee driven media. Just remember that you can still use that to encourage your communities to complete the census. And so Yahira said, can we as CHW support our families to complete them? You 100% can. From our standpoint, what I will say is definitely that's something you want to check with your employer and make sure that that's permitted and allowed. But what I will say is, this is a nonpartisan issue, whether no matter what end of the aisle you're on, quote unquote, Democratic or Republican, this helps everyone. Theoretically, everybody agrees with it. And I use that theoretically adjective very intentionally. But yes, please, as CHW, say, hey, here's the link you can go to. You can fill out this information. Just as a quick aside, make sure that they are including children in that count. oftentimes children are not considered, they might think how many adults are in the household, or, oh, I only have the kids for 6 months or anything like that. Wherever someone spends the majority of their time is the household they need to be counted under. And if all else fails, just count them in both households and let that be what it is. Because finish my sentence before I look in the chat now. Because what we want is for as many people to get counted as possible, and with an approximately 60% completion rate, we're far from overcounting citizens in the United States or non-citizens in the United States. Again, this is for anyone who lives here, period. And so the follow-up is there any marketing material? SC Count Me In, if you go there, I'm sure they will be more than willing to share. But if you do not get a quick response, especially Tanisha, because you have my contact information, please feel free to reach out to me and I will make sure that we get you something specific. But our folks on the Complete Count Committee, while not paid, they're doing this volunteer, they're still very quick to respond. So any of those marketing materials, any questions you have, how you want to get involved, you can A, go to the social media at SC Count Me In, or B, you can go to that census link and reach out to us via email. And so then Benita asked, what happens with the homeless population? So the way the enumerators have been working with the homeless population is identifying quote unquote hotspots where where folks experiencing homelessness might live. So whether that be underpasses or in parks or underpasses, overpasses, where they're pinpointing down to even folks who may be living in their car, things like that, and trying to get that count any way they can, going to homeless shelters, all those things. So is it 100% effective? We can never really be sure, and I would say no, because we never have 100% count. But I know that is one way that they're intentionally trying to go about making sure that folks experiencing homelessness are also counted. And so with that said, I think I am right on my 15-minute time. So really quickly, if anyone has any pressing questions, feel free to put it in the chat. Thank you, Anna. Yeah, Pasos is sharing the messages about the census on Census 2020 in our Facebook page. So please look at the Pasos site. They also have some stuff up. Mike Young has been very involved. He's actually on the committee with me. So shout out to Pasos. We appreciate you. And we know a lot of other people are involved. Anyways, back one more time. Thank you all. If you have any pressing questions, please put it in the chat and I can respond to you individually. I just don't want to go over my time. So thank you all for listening. Thank you all for responding. I appreciate the work that everyone here does, and I'm so glad to be a part of it. Go us.
All right. Thank you very much for sharing all of the information and for hopefully prompting us to remember, not only if we haven't already, to answer the census, but to do that, to communicate that constantly throughout, our within our families, our professional lives, our relationships, because it's that important to the state of South Carolina. It's that important to the people who live in South Carolina. You mentioned even the roads of South Carolina. I mean, there's just a tremendous amount of federal resources that we will not be able to participate in fully if we don't show a need, and that need is backed up by the numbers, right? So thank you again. With that, we're going to move down to the recognition of ambassadors and VIPs. Benita Clemens, Andrea Hayward, and Darren Thomas, would you all please take it away for the recognition of ambassadors and VIPs?
Hello, everyone. Donna, can you show the slide for the ambassadors, please? Just keep it there. Well, I'm gonna go on to slide 18. Slide 18 is the ambassador. Okay, so I'm gonna get started. So I would like to recognize this diverse and elite group of people, South Carolina Community Health Worker Ambassador. As you can see, they're all here on the screen. As we've heard a couple of people say today, community health workers have a motto: nothing for us without us. Nothing about us without us. And what does that mean? That means that we can share and tell our own story. That means that, I say we because I'm a community health worker also. It also means that we want to be involved when policies are are created. We want to advise the advisors. We want to be a part of our stories again. We want to be a part of all of the things that are, all of the laws that are made concerning community health workers. We want to be a part of that. And these people on this screen, this group on this screen, they took a year-long journey to give us their thoughts, their expert opinions, because they are experts in the field, but we listened to them and we have learned so much. We, meaning the Center for Community Health Alignment and the South Carolina Community Health Worker Association. We had several meetings. They all joined here in Columbia, or an entire day, so that we can just hear everything from them. And again, their expert opinion and advice has allowed us to do some amazing work. Thank you for your self-determination, and it proves that you all are really experts in the field. And so can we all give our South Carolina Community Health Worker Ambassadors a big round of applause? Woo! We love you, we love you. And we have another group that's gonna start, and some of the current ambassadors have agreed to be mentors to the next group. So thank you for those of you who will be mentors to our next group.
Thank you, Benita. Thank you, ambassadors. And we look forward to the next group of ambassadors.
Ms. Hayward is next.
Okay. Andrea?
Hi, good morning or afternoon. Well, is it still morning? We just got 5 minutes. Good afternoon, everyone. Andrea Hayward with the Center for Community Health Alignment. And I just would love to echo what Benita just shared about this wonderful group of ambassadors that have been alongside us on this journey and thinking about not just best practices, but best practices for the work that's happening in South Carolina. And just to let you all know that we are currently accepting applications for ambassadors to serve in the upcoming program year. The association did send that out through the listserv, but if you have any questions, I will put my email in the chat, and you can feel free to reach out to me specifically for information on the CHW Ambassador Program. But again, thank you to our current ambassadors, and especially for your willingness to continue to serve.
Awesome, awesome. Thank you, Andrea. Darren.
Yes.
There you go. The chair.
Yes. Thank y'all for so far. Thank you for the ambassadors. Yes, they've been a great help. And I also want to give recognize some other folks as well. I'd like to recognize some of the people who've been in the trenches way before I'd ever honestly heard of the term community health worker. These are some of the people that have helped build what is now known as the South Carolina Community Health Worker Association. Their tireless work has really positioned community health workers to be recognized as an integral solution to empower communities that are underserved and under-resourced. They also fought to make the community health worker a profession, a career option, by acknowledging and valuing community health workers' experience and education. The following are our 2020 South Carolina Community Health Worker VIPs. Virginia Berry White, LMSW, Director of Family Solutions. And Terry is jumping up and down the middle of my screen. I got distracted. And Dr. Rick Foster, Physician Consultant to South Carolina DHEC. Julie Smithwick, LMSW, Director, Center for Community Health Alignment. And Terry Jowers, Director of Healthy Columbia. Congratulations to all y'all, and thank y'all for the hard work that y'all put in it, and I know that you'll continue to put into this endeavor to making the South Carolina Community Health Worker Association a positive thing for all of South Carolina and its residents. Thank you.
Thank you, Darren, and Benita, and of course, Andrea, and especially a huge thank you to the ambassadors and the VIPs, as Darren just mentioned.
James?
Yes.
I
can't think of a better family to be a part of.
I was going to say at this time, 30 seconds to 1 minute. Our VIPs, I want each one of you to say something, just a 1 minute or less acceptance speech. 1 minute or less. Virginia? Miss Virginia, where are you?
Right here.
Let us see your beautiful face. Give us your acceptance speech. Thank you so much. Look at that beautiful face.
I accept this recognition with great honor, and it's been such an honor. And you all are not getting rid of me. I am going to continue the work. It's a passion and zeal of mine, and so you will find me somewhere. So thank you.
Rick Foster.
Tell you what, I am so honored and humbled. I can't, as I was getting ready to say earlier, I can't think of a better family to be a part of. As was mentioned earlier, I'm following those wonderful women towers of power. But I'm glad to be that man walking along with them. And it's amazing the work that's been done. It's so enheartening and hopeful that to see the progress that's been made with the Community Health Worker Association, and we've got a lot of work still to do. But Miss Virginia, today's a new day. There's nothing but sunshine.
That's right. I agree, Rick.
I'm channeling Kurt Franklin. That's my man.
Julie Smithwick. Julie.
Yes, ma'am. Thank you guys so much for this honor. I'm the only thing that's left off of this side is my CHW, because I am a proud CHW, and I tell everybody that I find that I'm a community health worker and what that means. I'm proud to be alongside these other folks who are so powerful and influential. I'll never forget the day that me and Terry and Virginia and Lily sat down because we were quite frankly, we were mad. We were mad that agencies in South Carolina were making decisions about community health workers and they weren't respecting what we said. And we said, you know what? We're not going to stand for this anymore. We're going to create associations so that we can have more power, so that we can use our voices, so we can amplify our voices, so we can amplify the incredible work that community health workers do. And out of that first meeting, and out of that empowerment that came from a little bit of a fire in our pants, fire in, in our seats of folks trying to make decisions without us, the association was born. And there's a lot of amazing people who have carried that torch since then. So excited to be part of this movement and to work right hand in hand with the association and with all the incredible CHWs and allies to keep moving it forward. So as they say in Spanish, adelante, let's keep moving forward. And cheers to everyone who are getting these awards today.
Derek Jowers.
Yeah, well, you really tricked me. I'm just almost speechless. You know, I feel like that my entire life that I have coming from a very poor, underserved community in Barnwell County, you know, I feel like this has been my life. This has been my life's work. And it is, you know, meeting these incredible folks and being able to work alongside of them. 3 of the people that I respect most in the world have just spoken. Virginia Berry White is an inspiration to me every day. Julie Smithwick, boy, she keeps us all our feet to the fire, right? Making sure that we are constantly advocating and trying to lift voices for community health workers. But I would not be here if it weren't for Rick Foster. Rick Foster, few people might know this, but he's the reason that Organizing for Health came to South Carolina, which eventually became Healthy Columbia. And so a lot of the community health worker movement, Rick and I have walked together, and I just respect him so much and everything he's done around health and especially community health in South Carolina. I want to say that this association is, I feel like it's my legacy. It's the thing that I've done outside of my children that I'm the most proud of. What an amazing opportunity it is to work with every one of you and to know that we are arm in arm in this together, advocating for our folks every day who very often don't have a voice. Thank you very much for this. I appreciate it.
Thank you, Terry. That was very heartfelt. I can tell very emotional, very honest. And I think everyone here feels the same way about what they do as a community health worker. Thank you. Thank you. Questions and reflections on today. Are there any questions or thoughts or ideas, things that have come to mind that you think should be shared with the group?
Remember, our speaker gave us an action item. So we all
did.
We're going to do.
That's right.
We got to make a personal commitment.
And he's still here.
Yeah, yep, I'm here multitasking. But listen, everyone, I really would love that to be one of the things that we can all remember from this conference, besides all this great information, and that is that one powerful, strong thing. I know everybody's working on behalf of CHWs or working as CHWs, but one thing in particular, that as a result of the information, the knowledge shared today, the experience you had today, that you will look forward to doing in the next few months that will progress the CHW movement in South Carolina. And I would urge people to jot it down, maybe fold it, and then start to work on it, and then look back at it down the road a piece, and maybe during one of the South Carolina CHW Association meetings, you guys could talk about some of the compromisos from today. Thank you, everybody. This has been an awesome experience for me from out of state. Thank you, guys.
Thank you, Durell. Any other, I mean, I know there's a lot of experiences on here. There's a lot of history. Any other questions or reflections that we can share amongst the group?
Hi, I think I just wanted to say thank you. Thank you for having organized this mini conference. Thank you for not saying, well, we have COVID and we are not going to do it. It's being, I'm assuming, a learning experience. Being also the first one, it's kind of cool to be part of the first ever. And like you were saying, Terry, what a legacy, because this is the beginning. It's a wonderful path. I love to be part of it. I love to have your support. I love to, the fact that we contribute and we're making South Carolina, that is a beautiful state, a much better state for everyone. So to me, this is like a wow. And I thank you all for the effort. Donna, I know that, you like to be behind, but let me tell you something. If it wasn't for you, we will not be here. So again, muchísimas gracias. Thank you.
Thank you. Thank you.
I just want to, this is Virginia. I just want to say that as there was a reverend in my church some years ago who passed away. And the thing that I remembered saying at his funeral that I always tell people as I go along, this is an organization that has flourished so much, and we've gone a long way, and we have a long way to go. But the thing that I will leave with our community health workers today, including myself, is to always show up. That's the 2 words that I want to leave. Always show up. You're treading a pathway for others. And every time you show up, regardless of where it is, you're changing the lives of somebody else. Somebody has done it for you. We did not get here all by ourselves. And now it's time for us to do it for somebody else, to do it for our communities, to make our communities better. And what a great time to do it during the pandemic when there are so many challenges that has arisen. And so my words again to us as community health workers, always show up, because at the end of the day, somebody is going to remember what we have done. Thank you.
Amen and amen.
I want to say for showing. Go ahead, Rick.
Real quickly, I know we need to wrap up. I want to say it continues to be a privilege to work with such a wonderful group. I hope that there's ways I can be of help going forward, especially in my role right now, working with both DHEC and HHS, the Medicaid agency. But as I said during our breakout, and maybe stating the obvious, in addition to the amazing work that all of you do in the communities that you serve, helping people and families, you have a very important role and a very important voice from an advocacy standpoint. Terry talked about the community organizing. Now more than ever, we need the voice of the community, those with lived experience, as we try to get those in positions of power to finally take action that they should have been taking a long time ago to eliminate racial inequities and social injustices. You have a very important role on the advocacy side as well. And anything I can do to help in that respect, your voice needs to be heard, and those you represent, their voices need to be heard. We finally need to make a movement in that direction. We all need to show up together to change, so that coming out of this pandemic, it's not back to normal, it's back to a new normal that's better. Thanks.
Very powerful words, very true. Awesome. Thank you, Rick. And just, I wanted to add this. It was great to have a physician, Dr. Reynolds, to also participate, because here you have community health workers, and there's a direct relationship with the physician community. And hopefully that will begin to grow even more, so that healthcare providers and community health workers will band together, not only just collaborate, but have a coalition that changes healthcare across the state and maybe even across the nation. So, yeah. So we can get some more physicians in, that would be great also. But thank you, Dr. Reynolds.
All right.
Benita, are there any other comments? All right, we have a conference evaluation. Would we like to have someone discuss how that's going to be done?
All right, so in the chat, I just sent to everyone a link to our evaluation.
Right.
If you could click on that, we're going to give you about 2 minutes, which should be all that's necessary to go ahead and complete that evaluation. So if you could just click on that link, and it'll take you to 6 questions. You fill those out. We're going to give you 2 minutes to complete that.
And we're back.
How did that sound?
It was okay. It was okay. It was a little bit better than some of the other audio. So hopefully you all enjoyed that jazz instrumental. I did. And we got the conference evaluations in. Those are also very, very important. I know you all are very familiar with doing evaluations and the reasons behind them. So now we have a community health workers are essential commercial. Are we ready to see the commercial?
Yep. Wait on that.
South Carolina community health workers are essential to the workforce, and
we love serving our community.
Our work is rewarding and fulfilling.
We are trusted members of our community.
We are a liaison for our community and healthcare system.
We impact the lives of generations.
We educate and advocate.
We are leaders in our communities.
We change lives. Le ayudamos a hacer cambios positivos en sus vidas.
We are essential.
Nice. I liked it. Can we get a round of applause for the commercial? That will be on WIS TV 10 later on today. No. All right. Guess what, everyone? It's time for our final door prize. Now, this, we have Miss Benita.
Yes.
Would you like to see? This is a different door prize, right?
Yes. This is the final door prize, which is a little different.
Okay.
So you have 10 seconds. I've already pulled 2 names. If the first person is not here, but I'm sure that person is here. Miss Latasha King. Miss Latasha King, you have 10 seconds.
Yeah.
Are you here? Let me see you, Latasha.
9, 8, 6.
All right, so Miss Latasha King receives, of course, a gift card.
Of course.
A $50 gift card, a South Carolina Community Health Worker t-shirt, and a journal.
Oh, thank you.
A nice packet from us later on. Thank you. Thank you so much.
Thank you.
For still being here.
Awesome. Well, congratulations to all of our winners. Congratulations to everyone who participated. You are all winners for being here, for doing what you do in the community, for being who you are to the community. And we're going to have some final remarks, and then a big surprise, even bigger surprise. So, Benita, would you like to start us off with those final remarks?
Absolutely.
Okay.
Of course, I want to say thank you to all of the participants for being on here, for being engaged. And oh my God, time went by really fast for me. So again, thank you. I want to say, echo something Miss Virginia said. Show up. Today, everybody showed up. So thank you, community health workers, sponsors, and other attendees for just showing up. Sponsors, one of the things that was so touching for me is that you didn't have to, but you were on the conference. When we do our in-person conference, of course, you will have a table, have all your materials there, but to be on this conference and to stay the whole time, that says a lot about who you are, and we are so appreciate you again for your financial resources to help us put this on. And again, we're gonna do in person. Can't say thank you enough to our sponsors, all of you. Thank you so much for, again, showing up. Community health workers, you all are the backbone of the association. Thank y'all so much for always showing up. for doing the hard work, for doing so much heavy lifting, especially during this time. Your training has really, really shown how much, how strong you are, how committed you are, how dedicated you are. And thank you again, community health workers, so much. Thank you for we have work groups. We have the annual conference work group. Thank you. Thank you, annual conference work group. We have the professional development group, which is led by one of our board members, Lily Fox. I got a text from Lily earlier. Unfortunately, a family member has passed away due to COVID. So she was able to get on a little bit, but Lily, our prayers are with you. Thank you for being a leader of that work group. And Miss Anna is a leader of our advocacy group. So thank you, Anna, for being the leader for that group. All of our VIPs. Oh, we love you. We love you. We love you. And I know it was a surprise to everybody, but especially you, Terry, because you and I were in on it with the other three, but Terry didn't know I had something for her too. Just want to reiterate, we will have an in-person conference when it is safe for gatherings. We don't know when that will be. So we're not going to put a date out there yet. We just know for sure that when it is safe, whenever that will be, we will have an in-person conference. We already have the space. We already have the food. We already have everything planned. We're just waiting for Miss Rona to get on through. And then we're going to have an in-person conference. So I look forward to having every single person on here and the other ones who could not make it today, because we are full to capacity at 200 registrants. So thank you again, everybody, for showing up, for sticking and staying with us, for being engaged. All of the presenters today, all of the speakers today, thank you, James, Donna. And if I forgot anyone, don't charge it to my head, charge it to my heart. Which way? Don't charge it to my heart, charge it to my head. How it goes. I hope I've not forgotten anyone. Thank you, James, for keeping us rolling. If there's anything or anything you think I forgot, please put in the chat, because sometimes when you're excited, you always forget something. And I don't want to forget anyone. Thank you to our special guest speaker, Mr. Durell. We appreciate you, all of the information and knowledge, and we are going to do our homework. I'm a teacher at heart. I will make sure everybody do their homework. Anything that I left off, thank you so much to our chairman, Mr. Darren, the chairman of our board. Thank you, Darren, for your work and your contribution. We appreciate you so, so much. And during the conference, we will have t-shirts. We'll have even more drawings at the conference, in-person conference. We do have t-shirts, and we have some other things that we'll have at the other conference. Again, thank you. I hope everybody did their evaluation. And Donna, do you have any final words? Let me tell you something about Donna. Oh, I want to mention our administrative assistant, Akira, is out on maternity leave. So she has a newborn little baby boy. His name is Carter. She and Carter are doing well. And so Donna is here assisting while Akira is out. And I cannot say enough about all of the hard work Donna is doing. I told people in my session earlier, each week, Donna and we walk 5 miles together so that we can talk and strategize and keep our health intact as we do this work. And I just want to say a special thank you to Donna for always showing up. She comes to my house all the time, and we sit on the porch. There have been some times when I go to her house, but unfortunately I hurt my ankle and my wrist, so I've been down for a minute, but she comes over every time. She stayed all day yesterday. So thank you, Donna. Thank you again for all your hard work. And again, thank you, community health workers, for being the best. You are essential, and I hope that you know that, and I hope that you feel that from the association. Thank you again.
Well, thank you. And I think we should all give our executive director, Ms. Benita Clemens, a huge round of applause. So Thank you for making this happen during this very difficult time, unprecedented time. But now we have to get a class photo,
Yeah.
right?
Yes.
So that is going to take enormous technical capability. And for the person who has that enormous technical capability, Donna?
All right, everybody smile and just keep smiling. Think of, it's the weekend, baby.
Susan, we need to see your face.
I got some.
Marina, Rebecca, Kimberly, I need your faces. Rebecca, where are you? Faces. I'm gonna do this too, though.
Oh, gosh.
All right, come on. You don't want to be seen as a name, a faceless person. All right, I'm getting some shots. Hold on, there's a lot of you here, so let's do this. I'm on the screen with a lot of no faces. Let's see. I know Lily had to leave, if I'm correct. Renika, Belinda, come on. Is this gonna be my block screen? Like a blockity block?
Where's Pauline?
All right.
Hollywood Squares
One more
reference.
second, guys, one more second.
Some of the older folks forget that.
Oh, y'all are beautiful. Thank you so much. Thank you.
Do y'all remember the Hollywood Squares? Okay, just check.
That would have been a nice little game to put together. We could have just like randomly selected a square for that card that you keep trying to give away.
Someone has to be Pauline.
Thank you.
So, Donna, we still taking pictures?
No, I'm done. Thank you.
Oh, okay.
We're still smiling.
I know.
It's been
Benita.
a pleasure. Thank you.
All
Thank
right.
you, everybody. I appreciate you so much. Y'all take care. We love you again. This conference is Love in Action, and we love you. Thank you, everybody, especially our community health workers. Woo!
Y'all have a great weekend. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank
Have
you
a
so
great
much.
day.
Guys, bye-bye.
Thank you.
I'm walk everybody to the door.
Sorry we didn't have better snacks.
I'll get you next time. Hey,
told y'all.
Cindy. Hi, Cindy. Anna.
Bye.
Hi.
It was amazing.
Yes, thank you.
You are awesome. I love
You
your
are. Huh?
I love your energy. It's contagious.
Okay, good, good, good. And you look so wonderful on the commercial. Go to our YouTube and look at the commercial.
Thank you.
Bye, y'all.
Have
Bye.
a good day.